Today my speech is on childhood absence epilepsy. I recently had a patient who was 6 years old who had been having staring spells for the past 3 years. His mother noticed these spells but thought he was daydreaming or just being inattentive. Childhood absence epilepsy is a seizure disorder that may pass unnoticed by family, friends, and teachers. In this presentation, I will give you a little more information about childhood absence epilepsy, including symptoms, diagnosing, and treatment. To begin, I'm going to start with a couple key terms: epilepsy and seizures. Epilepsy is simply defined as a condition with recurrent unprovoked seizures. When 2 or more unprovoked seizures occur, an individual is diagnosed with epilepsy. The term epilepsy is just not one seizure disorder. It is a diverse category of seizure disorders. The classifications are based off of the clinical manifestations, the onset of the seizure, and the clinical syndrome. A seizure occurs when the electrical system of the brain malfunctions. Instead of discharging electrical energy in a controlled manner, the brain keeps on firing, resulting in a surge of abnormal energy within the brain. Childhood absence seizures are classified as a generalized epilepsy, or a seizure disorder that affects both hemispheres of the brain. Absence seizures primarily consist of brief staring spells, in which a child's awareness and responsiveness is impaired. There is no aura or warning to the seizure, and immediately afterwards, the child is completely alert. The cause of childhood absence seizures is unknown. They may be associated with head injuries, brain tumors, or infectious illnesses. There may also be a genetic component involved or suspected. Absence seizures Absence seizures frequently occur in females more than males, with an onset age between 4 and 14. Regardless if the child is younger or older, or male or female, the symptoms are the same. Absence seizures are divided into 2 categories: simple and complex. Simple absence seizures consist of a temporary loss of consciousness. The seizures consist of a staring spell with a sudden pause in activity, like an interruption of talking, walking, or eating. The child may seem like he or she is daydreaming or being inattentive. The eyes may appear to be vacant or roll upwards, or the eyelids might droop slightly. The seizure may last less than 10 seconds and only as long as about 20. After the seizure passes, the child resumes what they were doing as though nothing happened, and usually have no recall that an event has occurred. Complex absence seizures are associated with the same symptoms as simple absence seizures, with a few additional. The symptoms may vary from child to child, but may include a repetitive motion of lip smacking, chewing, grimacing, swallowing, fumbling with clothing, or repetitive hand movement. Other symptoms may include pupil dilation, flushing, salivation, or urinary incontinence. Complex partial seizures usually last longer than 10 seconds. Once the symptoms are noticed, the child should be taken in for further testing. An EEG is the primary method of diagnosing and evaluating childhood absence seizures. An EEG records the electrical brain activity through sensors placed on the head, which are connected to wires and then linked to the computer. The computer records the electrical brain activity on the screen as wavy lines. Certain conditions, like seizures, can be seen as a change in the normal pattern in the brain. The abnormal pattern seen with absence seizures is 3 per second spike and wave complexes. Here I've got an example of a normal EEG. And then I also have an example of an abnormal EEG. Notice the difference between the two. During the recording, an EEG tech may use an activation procedure of rapid breathing for 3 to 5 minutes. This activation procedure alters the oxygen and carbon dioxide levels in the body, possibly provoking an absence seizure. Although this activation procedure is not necessary to bring out the abnormality. An ideal EEG recording would capture a child's spell, but it is not necessary for diagnosing childhood epilepsy. Once the child is diagnosed with absence seizures, a treatment plan is developed. The appropriate anti-epileptic medication is chosen. The most commonly used medication is Speech.Avi. With the assistance of medication and the support of the family, the child with childhood absence epilepsy can and do live normal lives. Although childhood absence epilepsy is a subtle seizure disorder, there is no reason it should pass unnoticed or undiagnosed. Absence seizures are frequent, brief episodes of staring and occasionally are accompanied by other symptoms. When it comes to diagnosing and evaluating absence seizures, an EEG is the primary method. Children diagnosed with absence seizures are no different than any other child and should be encouraged to live normal, active lives. Over the majority of time, children diagnosed with childhood absence epilepsy grow out of the seizures. However, half of the children end up developing more complex seizures. In the case study that I had spoken about before, our patient was diagnosed. His seizures are now controlled with medications, and he continues to live a normal life. Thank you.